Left ventricular non-compaction, or LVNC, is a rare heart muscle disease. It affects the heart's main pumping chamber, the left ventricle. In LVNC, the heart muscle develops abnormally. The walls of the left ventricle become thick and spongy. They have deep recesses or trabeculations. These trabeculations are filled with blood. This abnormal structure makes it harder for the heart to pump blood effectively. LVNC is a type of cardiomyopathy. Cardiomyopathy means heart muscle disease. There are different types of cardiomyopathy. Each type affects the heart muscle in a different way. LVNC is considered a primary genetic cardiomyopathy. This means it's usually caused by a genetic mutation. The exact cause of LVNC is still being studied. However, researchers believe that it occurs during fetal development. The heart muscle doesn't develop properly, leading to the characteristic trabeculations. This abnormal development affects the heart's ability to pump blood efficiently. Understanding LVNC is important for early diagnosis and treatment. It can have significant impacts on heart health. In the next section, we will delve into the symptoms of LVNC and their variability. The symptoms of LVNC can vary greatly from person to person. Some individuals with LVNC may experience no symptoms at all. This is particularly true in the early stages of the condition. Others may have mild symptoms like shortness of breath or fatigue. In more severe cases, LVNC can lead to heart failure, stroke, or even sudden cardiac arrest. The severity of symptoms often depends on how much the heart muscle is affected. If the trabeculations are extensive, the heart's pumping ability may be significantly impaired. This can lead to fluid buildup in the lungs, causing shortness of breath. Fatigue is another common symptom, as the heart has to work harder to pump blood. In some cases, LVNC may cause chest pain or heart palpitations. Chest pain can occur due to reduced blood flow to the heart muscle itself. Palpitations or irregular heartbeats can arise from the abnormal heart rhythm sometimes associated with LVNC. It's important to note that these symptoms are not exclusive to LVNC. They can also be indicative of other health conditions. If you experience any of these symptoms, it's crucial to consult a healthcare professional for proper diagnosis. Ejection fraction, or EF, is a measurement of how much blood the left ventricle pumps out with each contraction. It's expressed as a percentage. A normal EF is typically between 50 and 70%. This means that the heart is pumping out 50 to 70% of the blood in the left ventricle with each heartbeat. In LVNC, the heart muscle's ability to contract and pump blood effectively is often compromised. This can lead to a reduced ejection fraction. A lower EF indicates that the heart is not pumping as strongly as it should. Monitoring EF is crucial in LVNC because it provides valuable information about the heart's overall function. A lower than normal EF doesn't always mean a person will have symptoms. However, it does increase the risk of complications such as heart failure. Regular monitoring of EF allows healthcare providers to track the progression of the condition and adjust treatment plans as needed. Early detection of a declining EF can prompt interventions. These interventions can help manage symptoms and prevent further heart damage. In the next section, we'll explore the risk factors and genetic predisposition associated with LVNC. While the exact causes of LVNC are still being investigated, there are certain factors that may increase a person's risk of developing the condition. LVNC can affect individuals of all ages, races, and ethnicities. However, it is more commonly diagnosed in men than in women. Genetics plays a significant role in LVNC. In many cases, the condition is inherited from a parent who carries a gene mutation associated with LVNC. If a parent has LVNC, there is a 50% chance that their child will inherit the gene mutation. However, not everyone who inherits the mutation will develop the condition. Other factors that may contribute to LVNC include certain congenital heart defects, neuromuscular disorders, and metabolic disorders. Hypertension or high blood pressure can also worsen the condition. It puts additional stress on the already weakened heart muscle. Identifying individuals at risk is essential for early diagnosis and management of LVNC. Genetic testing can be helpful in confirming a diagnosis and identifying family members who may also be at risk. Understanding the genetic component of LVNC can guide treatment decisions and family planning. Section 5. Diagnosing LVNC, imaging the heart. Diagnosing LVNC typically involves a combination of medical history review, physical examination, and imaging tests. Echocardiography, also known as an echo, is the primary tool used to diagnose LVNC. It uses sound waves to create detailed images of the heart's structure and function. During an echo, a technician will apply gel to the chest and then move a transducer over the skin. The transducer emits sound waves that bounce off the heart, creating images on a monitor. The images allow cardiologists to visualize the heart's chambers, valves, and muscle thickness. Another imaging test used to diagnose LVNC is cardiac magnetic resonance imaging, or MRI. Cardiac MRI uses magnetic fields and radio waves to create detailed images of the heart. It can provide information about the heart's structure, function, and blood flow. Cardiac MRI is particularly useful in cases where echocardiography may not provide a conclusive diagnosis. It can help differentiate LVNC from other heart conditions with similar features. In addition to these imaging tests, electrocardiograms, or EKGs, may be used to assess the heart's electrical activity and identify any rhythm abnormalities. Section 6. Prognosis and potential complications. The prognosis for individuals with LVNC varies depending on the severity of the condition and the presence of any complications. Some people with LVNC may live long, healthy lives with minimal symptoms. However, others may experience more significant complications that require ongoing medical management. One potential complication of LVNC is heart failure. Heart failure occurs when the heart muscle is too weak to pump blood effectively, leading to fluid buildup in the body. Symptoms of heart failure can include shortness of breath, fatigue, and swelling in the legs and ankles. Another potential complication is arrhythmia, or irregular heartbeat. The abnormal structure of the heart muscle in LVNC can disrupt the heart's electrical system, leading to abnormal heart rhythms. Some arrhythmias can be life-threatening if not treated promptly. LVNC can also increase the risk of stroke. The abnormal heart muscle can trap blood clots, which can then break free and travel to the brain, blocking blood flow and causing a stroke. Blood thinners may be prescribed to help prevent clot formation in individuals at risk. Section 7. Managing LVNC treatment strategies. While there is no cure for LVNC, treatment focuses on managing symptoms, preventing complications, and improving quality of life. Treatment plans are individualized based on the severity of the condition and the presence of any complications. Medications are often prescribed to manage symptoms and reduce the workload on the heart. These may include ACE inhibitors. These medications help relax blood vessels, lowering blood pressure and making it easier for the heart to pump. Beta blockers. These medications slow the heart rate and reduce blood pressure, reducing strain on the heart. Diuretics. These medications help remove excess fluid from the body, reducing swelling and making it easier to breathe. In some cases, more invasive procedures may be necessary. Implantable cardioverter defibrillators, or ICDs, are small devices that are surgically implanted under the skin. They continuously monitor the heart rhythm and deliver an electrical shock if a life-threatening arrhythmia is detected. For individuals with severe LVNC who develop heart failure, a heart transplant may be considered as a last resort. A heart transplant involves replacing the diseased heart with a healthy heart from a donor. Section 8. Living with LVNC, a message of hope. Receiving a diagnosis of LVNC can be overwhelming. It's important to remember that with proper management, many people with LVNC can live full and active lives. Early diagnosis and treatment are crucial for preventing complications and improving outcomes. Making healthy lifestyle choices is essential for managing LVNC. This includes eating a heart-healthy diet, focus on fruits, vegetables, whole grains, and lean protein sources. Engaging in regular physical activity, talk to your doctor about an appropriate exercise plan. Managing stress. Find healthy ways to cope with stress, such as yoga, meditation, or spending time in nature. Avoiding smoking and limiting alcohol consumption. These substances can damage the heart and worsen LVNC. It's also important to attend regular checkups with your cardiologist to monitor your condition and make any necessary adjustments to your treatment plan. By taking an active role in your healthcare, you can maximize your chances of living a long and healthy life with LVNC. Section 9. Seeking support and resources. Living with a chronic health condition like LVNC can be challenging, but you don't have to go through it alone. There is a support group on Facebook called LVNC Left Ventricular Non-Compaction Cardiomyopathy Research with a lot of helpful information and people with LVNC. Remember that you are not defined by your diagnosis. With the right information, support, and medical care, you can live a fulfilling life despite the challenges of LVNC. Please like and subscribe.